FitDoc Michele Reed, and I want to thank you all for sharing that last video that I did that was done at Hempstead School District when about a week ago, when there was a concern from a lot of people in the district as far as what was going on with coronavirus. Many people shared it, many people watched it. I received so many texts and just general comments from people. So I want to really first thank you for doing that. So I am following up today about the coronavirus. A lot is going on. As of right now in New York State, we are on a curfew. So people are saying, oh my goodness, what's going on? What's going on? A lot is going on. We are in unknown territory right now, and it's very important that we follow the direction of what the doctors are saying, what the government is saying, despite our differences and how we feel about our politicians. It's important that we are one in this all together. Safety is the key. Last night I was on a conference call with the NAACP, and they partnered with other organizations. It was over 20,000 people on the conference call. The Surgeon General, Dr. Adams, he was on, and he talked about right now what we're trying to do is to mitigate things. We want to decrease the risk and the rate of infection, and at the same time decrease the deaths that are occurring because of coronavirus. Many things that are going on as far as how it's transmitted, how it's spread, but the point now is we know it's here. We don't know where it came from, but we know that we need to take proper precautions so that it doesn't spread. So since we are on a curfew, especially in New York, and some other states have the same thing, what are we going to do? We are going to follow the lead. So if they're saying stay inside the house at 8 p.m., we're going to make sure that we are home at 8 p.m. unless for some emergency reason we need to be outside the house. We're going to respect it. We're going to respect what the law enforcement is saying and what the government is telling us to do. Social distancing, key thing. Please do not be up in anyone's face. And when we say social distancing, if you can stand at least 6 feet away from someone, please do that. Because when you're in close contact, when someone's coughing or breathing on you, any respiratory droplets that comes out of their mouth can get transmitted to you. And guess what? You might wipe your face, wipe your eye, because now we're seeing cases of it, not only the coronavirus affecting our lungs, we're also seeing it affecting our eyes with conjunctivitis, and then also affecting the GI tract, where we're having people who are having vomiting and diarrhea. So keep that distance, 6 feet. If someone tries to hug you, please try and refrain from hugging. If you want to do the little kick thing and kick with your leg, if you want to do the elbow thing, it's fine to do the elbow thing, but respect everyone's space. I know a lot of kids are now home because schools are closed. It's important because the incubation period is up to 14 days. And when I say incubation period is up to 14 days, that means that someone might have it that you've been around in the last couple of days who does not have any symptoms of the disease and could actually spread it to you and other people. If that is the case, it's important that we respect that 14 days. So do not have your kids up in each other's faces. Have them try and limit their space and their time when they're in each other's faces. Because otherwise, if one child gets it, the next one will get it, and before you know it, it's in the whole household. So if you can, just try and just keep your distance with your family members. Someone had asked me a question earlier, because I said before I posted this, if you have any questions, let me know. Can I be intimate? You can be intimate, but just be careful with any type of exchange that you have orally with whoever you are intimate with, because we have to be very careful about our social distancing. Okay? Another thing is washing our hands. We have to be very vigilant about washing our hands. Washing our hands for how many minutes and seconds?
20 seconds.
20 seconds. 20 is the key. Wash your hands for 20 seconds. And when you wash your hands, try and grab a paper towel or a tissue to turn off the faucet, to do the doorknob, and then also to turn off the light switch. because any germs that you brought into the bathroom, you don't want to take them back out. At my office, because I'm also a school district physician for 3 different school districts, and before I forget, for Malvern, Roosevelt, and Hempstead, I'm very proud of how the superintendents, the administration, and the teachers have been over the last couple of weeks, and especially this past week with everything that was going on. So I was touching in daily with them as to what needed to be done so we can prepare for possibly what was going to happen, and this is where we are. So very proud of you all. So going back to that is, I want to talk about cleanliness and how to protect your space, protect yourself besides washing your hands. So, you know, I like to have teamwork. So I am involving the staff from MS Family Medicine with me today. Can we get a cheer? Okay, let's go team. So the first thing that I think Naila is going to bring up is what?
We have our Lysol that we try to spray after each patient or that may feel sickly, or if just to
make sure we don't have any germs
around, any symptoms. So we try to spray after each and every patient, not to be rude, but it's just a precaution. At the office, we try not to stay close to each other. We try not to touch each other, as you never know how you might catch any germs. So we try to do that as much as possible.
All right. Thanks, Naila. And next up we have Yvette. Yvette, what's your tip? And what do you have?
The Purell. So I have the Purell. So after touching each and every doorknob, when the patient comes in and leave, we ask them to please use hand sanitizer. Make sure you rub it all over your hands, and make sure the surface that you're touching is also clean. So once the patient also leaves, we make sure we wipe down with our Clorox wipes to make sure the counter is clean, the door handles are clean, and we keep in our office sanitary.
And the exam tables.
And the exam tables. And chairs.
Mm-hmm. And
so
chairs.
making sure everything is sanitary in the office.
All right, Naila, what else you have up?
We also have the Kleenex. We try not to touch any more surfaces. Like, we try not to touch any surfaces. We try, like Dr. Reed previously stated, when we try to touch the doorknob, we try to grab a Kleenex. The phone, we try to wipe after it.
What about when our patients coughing and sneezing?
We try to offer them Kleenex, and we try to let them know that you could grab. It's accessible to each patient. It's accessible in every room, the bathroom, the lab, just to make sure that everybody's safe and clean and prevent from catching any viruses.
What else do you have next to you?
And we also have gloves for our medical assistants and Dr. Reed as well. So when we're touching the patients and the instruments, the stethoscope, the blood pressure cuff, we try to have gloves so we don't touch anything. And we also have a mask for anyone that may feel like they're coughing or sneezing. We try to have it accessible for any patients. So when they come in, if they feel like they're not too okay, they tend to sneeze and cough, or we try to have it accessible for the patients also, and some of the staff that may feel like.
Last but not least, keep hydrated.
Yes, it's important that you stay hydrated. So everybody knows how much I love Essentia. So this is my bottle of water.
That's her bottle of water.
One of the other things, I was talking to one of my friends who also has her own office. We were thinking about magazines because we don't really know, and we know that the coronavirus will stay on a surface up to 48 to 72 hours. So what we're going to do is we're getting rid of these magazines. We saw patients today. We were here on Saturday. We don't know how long they've been, but we did have some sick people on Saturday and today. So it's really a good idea if we do toss the magazine. So if you can't wipe down something that you know someone's been around coughing, because a lot of people are coughing, and cough is one of the key things. Chest tightness, chest burning, you feel like you can't really breathe, fever, and flu-like symptoms. If you have any of those things, you need to contact your doctor. And if in the event you cannot contact your doctor, we have a link that you can go to. And this is with the federal government.
It's Find Healthcare Center, HRSA.gov.
Okay, this is key. And all you have to do is click on the link, put in your zip code, and it'll take you to the link of the site that's closest to your area. Okay, and that's a nationwide link that you can use. And I tested it out to see how it was for different cities, and it definitely does bring up locations. The only thing that's not listed, of course, is the hours of the location. But if you have any fever, flu-like symptoms, severe cough, respiratory distress, please contact your doctor. And if you can't reach your doctor, click on that link. So that way, we'll also post it in the body of the video too. So key things. Some of the concerns, someone says, well, if I have a child, can my child get it? Your child, yes, can get coronavirus, but your child is more likely to get the flu than coronavirus. As far as crowd control, originally they were saying 50, but now they brought it down to no more than 10 people together, and to still practice social distancing with 10 people. People who have comorbidities, and when we say comorbidities, we're talking about diabetes, any type of respiratory disease, heart disease. Those people, especially if they're above the age of 60, they are at an increased risk of getting coronavirus. So very important that if you are around anyone who has those different diseases, is that you need to not only protect them from you, but the opposite. Because if they're out and about, or you're out and about, both of you can contaminate each other. But if those people have comorbidities, they are at an increased risk of dying or having to get hospitalized because of coronavirus. If you have any elderly parents or grandparents, please refrain from going to visit them. This morning I had to talk to my parents because at 8:30 this morning my mother was already at physical therapy, and I was like, Mom, Dad, please go straight home, because we do not need our elderly population, our more senior people, to get sick, because when they get sick, more than likely they will be hospitalized. So key things. So yes, children can get it, but we do have cases where people who are younger than 60 who have been hospitalized because of it. But either way, it can happen to anyone, but let's do the social distancing and protect each other. You get tested if, for one, you've been around anyone who has the virus, and if you are having any type of cough, severe respiratory distress, fever, and the fever is usually above 103. Those are all indications of that you need to be tested. For now, I mean, we don't really have people that are coming in from the hot spots, the countries that are the hot spots, but we still need to be careful. Because of this incubation period, we're sort of shutting everything down to sort of calm things down, and like I said, to decrease the risk and the spread of the infection, and also decrease the risk of death. So I know I gave a lot of information. I tried to give as much as I can, but I'll probably jump on again maybe in the next 24 to 48 hours to answer any other questions anyone has. But I want to thank the one and only Antonio Kelly, who filmed that other video that we did, Picture This, who helped to just say, remind me like, okay, you know what? Maybe we should do a follow-up as to what's going on, because there's a lot of information out there, and you need to review the CDC website. That's CDC. And also you can look at the WHO website, WHO. So CDC is really the go-to place about all different things that are going on. But what I really want you to do is try to be safe, really practice the social distancing, because we really have to nip this in the bud and decrease the risk of people having the exposure to coronavirus. Those are the key points. But anything else, feel free to DM me, social media, Dr. Michele Reed at FitDoc.com. That's my email. But on Facebook, on Instagram, it is FitDoc Michele Reed. That is FitDoc Michele with 1L REED. We're in this together. Any questions at all, you can let me know. For my patients out there, the office, yes, we are going to be open this week, just like usual business. But from the same time, we do have the 24-hour answering service call. So you can still call us at any point in time if you have any questions before you head to the hospital. Because the key is you don't need to go to the hospital unless you are in severe respiratory distress, extremely high fever, disoriented. Please do not show up at the hospital, okay? And I want to thank all of my people, my fellow hospital workers, from the doctors to the nurses to the assistants, the administrative staff of hospitals, because I know it's not easy, because even with the practice, we've been very busy. I feel like I didn't even get a break from Saturday, but we're all doing the best that we can. So please stay in close contact with your doctor if you have any question at all, because here at MS Family, we are a family. I'm trying to keep my family nice and safe. And when I say family, I'm talking about my family, but also the MS Family staff and my patients. And that's why we did this. I incorporated the staff, and that's why I showed you some of the products that we use, because we all need to be healthy in order to fight this together. Thank you.